6, patients must learn new behaviors in all relevant contexts. So they need to be able to do whatever it is that you're teaching them to do in skills group or whatever it is you're teaching them to do in individual. They need to be able to generalize that to other places, not just in the therapy office. Well, how will you know? How would you know that they were doing that? You wouldn't necessarily know. And the best way to help patients generalize things like that is to help them in the moment. But they're not having problems in the moment a lot of times. They're in your therapy office and it's nice and cushy, or they're at home and they're in their pajamas or whatever, and they're just relaxed with their tea. So then how can you help them in the moment? That's what phone coaching is for. So it's a large part of why we do phone coaching, because it's so exciting. We catch them right in the moment that they're in, right then. And then we say, oh, this is great. This is a wonderful opportunity. Let's try using, for example, opposite action. So let's imagine that Lisa used her phone coaching, which we would have oriented her to. She would call or she would text. I prefer that they text. So she would say, is this a good time? And I would say yes, or I would say, give me, a few minutes or something. And then I would call her and she would say, I think I'm going to go off on this, fill in the blank, what she calls her boyfriend. And so I say, oh, this is a wonderful opportunity for us to use skills. And then, of course, I'm sort of making a joke at the same time. I'm keeping it light. And she knows that I'm not put out, because I'm actually not put out, most likely at that point. And so I say, let's use opposite action. And opposite action is when you do the complete opposite of what your emotions tell you to do. So Lisa is angry. She wants to strike out. She wants to tell him everything that he's doing wrong and why he's lucky to have her, and maybe even tell him to get out, and whatever other kind of unskillful interpersonal behavior she might be engaged in. So she hasn't done that yet, which means we have that opportunity. And that reframe that I just did, where I said, oh, great, this is a wonderful opportunity, is what's called making lemonade out of lemons. That's what they call that in DBT. Making lemonade out of lemons. So I would reframe, say, this is a great opportunity. Let's do opposite action. I imagine that you're feeling pretty pissed. Yes? Yes. And what is it that you want to do? I want to confront him. What is the opposite of confrontation? Well, it depends, right? If you're the kind of person who the opposite of confrontation is to retreat, to go away and center yourself, okay? Or are you the kind of person that the real opposite, the all the way opposite, would be doing something nice for someone? Imagine how difficult that would be when you are in the middle of a very, very strong urge to be ugly to somebody, and maybe you even just don't want to hold their hand, or you just want to pout. Then doing the opposite would be doing something nice. Very powerful skill, very difficult skill. So I would tell Lisa that. I would say, I'm just not really sure that you would be able to do this, but if you're desperate, I highly recommend this. And that usually gives people a little bit of motivation, because we've all got a little fire in us, I think, I think I could do that. Now, they usually will say, that's the last thing I want to do. And I say, no doubt, because that tells me it's an opposite action. No one ever wants to do an opposite action. By definition, no one wants to do an opposite action because it's the opposite of what you want to do. So then, what might Lisa do? Usually they can come up with things on their own. I have known people to give hugs. I mean, you got to know your audience kind of thing. But I've known people to give hugs. I've known people to say nice things. I've known people to make things, like cook something nice for someone. There are also ways to do it without doing it directly to that person. I had one recently that sat and wrote out all of the positive things about that person, everything that they were, grateful for, that they liked about that person. Very, very difficult to do both of those at the same time, to be angry and grateful at the same time. So these are incompatible together in full. You can't be 100% grateful and 100% angry at that person. So that's what we're doing when we do opposite action.